Hi, my name's Nia.
I'm Andrea.
And today we're doing a video for our OTS 815 neurological class. We're doing it over dysphasia and what it is and how it may affect individuals and their ability for feeding. Dysphasia is when an individual has difficulty swallowing. Individuals with dysphasia may experience choking or coughing when eating or drinking.
So our case today is about Denise, who is a 52-year-old female with the diagnosis of fibromyalgia and has reduced fine motor coordination and grip strength, bilateral upper extremities. We're supposed to engage client in a feeding task using appropriate adaptive equipment as needed to promote highest level of independence. So the National Institute of Health describes fibromyalgia as a chronic disorder that causes pain, weakness, tenderness, and difficulty sleeping. Individuals with this disease may struggle with overall weakness, causing them to have difficulty completing activities of daily living, such as feeding.
So today in this video, what we're going to be talking about is some interventions that would help benefit our client Denise. And so Andrea is Denise now. And so for these interventions, what you're going to want to do is, for fibromyalgia, since she's having all these difficulties with her gross motor coordination and grip strength with her bilateral upper extremities, what we're going to do is we would introduce the high scoop plate that you can tell the difference of, like that. And then since she is having difficulty with that motor coordination, we would introduce the non-slip mat. And so you'd have it in front of her and you would have your plate right there because it would prevent the mat from scooting whenever she is scooping and eating with her utensils. And then another way, this is also an energy conservation technique, just because this is preventing her from having to chase her food and keep her plate there and make sure nothing's slipping or falling or anything like that. Another energy conservation technique is you would want to sit 90, 90, 90 with your feet flat on the floor, and then you'd want your forearms up on the table just to take away from that effort that it would take to hold them up if they're not on the table. And then also, whenever people with dysphagia are eating, you want to keep your head slightly down to prevent choking. Not all the way down, not chin to chest, just slightly down like how Andrea has it. And that would just really preserve you from having to choke or use extra energy from keeping your head up.
Okay, so for our second intervention, I'm gonna do it on Nia, and so we're gonna have her using the plate and then the slip mat, and we're gonna have her sitting 90, 90, 90 like we discussed earlier. And I'm going to talk about some adaptive equipment that we can use for individuals who suffer with weakness and with dysphagia. So this is just a fork, and it has a built-up handle, so it's easier for her to grasp. It takes away more energy to grasp and hold on to the fork. So I'm going to give this to her, and she can show you how she would scoop it against the plate. And just making sure that she sits 90, 90, 90 with her chin tucked to prevent choking. And then we also have a spoon with a built-up handle. You can take this off and put this on in order to build up any type of utensils. So here's a spoon, and then we also have a fork with the built-up handle as well. This will just be easier and help her conserve energy and just being able to cut and hold on to her utensils. And then this is some adaptive cups. So with this cup, and she has difficulty with her grasp, so you can slide your hand underneath this cup and bring it up to your mouth like this, and just make sure that you're instructing your client to take slow bites, small bites, to chew slowly, so they can prevent choking, and just educate them on certain foods that may be more at risk for choking. And then this cup as well, you just slide your hand under and bring it to your mouth. And then that is all of the adaptive equipment that we have that we would use for our case study about Denise. We would just work on overall weakness and modify that ADL of feeding for her, and just educate her on proper positioning, energy conservation, and just some adaptive equipment that would be beneficial for her to be more independent in this task.